Welcome, everyone. Thank you so much for joining us on this Saturday. Today's workshop, The Truth About Liver Cancer, is produced by Blue Faery, the Adrian Wilson Liver Cancer Association. A nonprofit organization, Blue Faery's mission is to prevent, treat, and cure primary liver cancer, specifically hepatocellular carcinoma, also known as HCC. Remember that, you're going to hear it a lot, through research, education, and advocacy. My name is Andrea Wilson Woods, and I am the president and founder of Blue Faery. I started Blue Faery in memory of my sister, Adrian. When I was 22 years old, I got custody of a then 8-year-old Adrian, and we were living in Los Angeles. I raised Adrian all through my 20s until she died at the age of 15 from stage 4 hepatocellular carcinoma, again, also known as HCC. That was back in 2001, and Adrian only lived 147 days with her diagnosis. I'm very happy to say that things have come a long way, and we have an incredible workshop for you today. And this one's always very special for me. This is our third Caregivers Corner, but we have a variety of caregivers today. So today's workshop focuses on caregivers of people who had or have liver cancer. So our panelists today include spouses, a parent, and an adult child, and they are going to share their experiences caring for a loved one during their treatment journey, managing their symptoms, seeking support, and so much more. So again, this one's super special to me, and big shout out to our program manager, Aura Sanchez. Normally, we try to have 3 to 4 panelists on this workshop. We have over delivered today. We have 5 panelists, 5 panelists. So excited for you to meet them. Now, please know you can chat at any time. If you have an issue, you can chat our host. Well, I'm the host. You can chat Aura, the co-host. She's there behind the scenes, I promise. But please, if you put questions in the chat, put those in the Q&A, because we are going to do a Q&A with all of our panelists coming back to the stage at the top of the hour. So please put those questions as they come up in the Q&A, which you should be able to see on the toolbar of Zoom. If for some reason you can't see that toolbar, take your mouse and slowly glide it over the screen right now toward the bottom, and the toolbar should pop up. So again, if you have any questions, put them in the Q&A and not the chat. And if you can see a question that you like, you can upvote it, so we will know which question to answer first. All right, I am so excited to bring our very first panelist to the stage. Aura, please welcome Cathy Anderson. Cathy Anderson's personal journey deeply informs her perspective. After losing her husband, Matt, to hepatocellular carcinoma in 2003, she navigated the challenges of raising 3 young sons, then ages 6, 4, and 1. In 2008, she blended her family through remarriage to a widower who also lost his wife to cancer, further broadening her understanding of caregiving dynamics. Professionally, Cathy has dedicated her career to spearheading complex data and technology initiatives in both academia and industry. Cathy, thank you for joining us.
Thank you so much for having me. Looking
Well,
forward to it.
we've known each other a long time, and I
We
am just
have.
so happy you're doing this. So take us back, because your experience was almost as long ago as mine.
Mhm.
Before Matt was diagnosed, what was life like for you and your family?
Well, we were a young family, as you mentioned. The kids were young. I think before the diagnosis, they were 5, 4, and 1, and we had just moved into our dream home. So life was great. We were getting integrated into this new community, getting to know our neighbors. Matt was 35 at the time and healthy, athletic, working in the consulting field. And so life was good until one Saturday morning when he woke up with intense abdominal pain.
So, take us back to that when he started experiencing that abdominal pain. How did you get from that to his diagnosis?
Right. So, this was a Saturday morning, as I mentioned. It sort of came on like a freight train. We had taken the kids out to a local park in the morning, and by noon, he couldn't eat lunch. It was just so strange. Someone who's not sick much at all, right? And so, we went home. We had, I think, soccer for my oldest son. So we sort of divided. I had to kind of convince him to keep the 1 year old so I didn't have to follow him around the soccer field. Um, and so when I got back, he was in the bathroom getting sick. I mean, it was just so, we waited through the weekend because Matt has a brother who's a pulmonary doctor at Georgetown and a sister-in-law who also is, and we certainly reached out to them because this was so odd. And they were like, maybe it's the appendix or something. So we waited the weekend, and then Monday morning, he decided to go to the ER. There's no way he was going to work. And so I was in the middle of, getting my kindergartner ready for school. And I said, you go on over and I'll meet you there. And so that's sort of what happened, started all off.
That's how we started too, what was in the ER. And something I forgot to mention to people watching, not if you're watching the replay, but if you're watching live, there's a little reaction button in the toolbar, and feel free to give some love to our panelists and show them some reactions. You can like it, you can love it, or I can do an example right now. All right, so you go to the ER and talk me through what happened at the ER.
Yeah, so by the time I got there, they had already done an ultrasound, which revealed this large mass on his liver. And so the doctor had come in and said, so we do need to do that CT scan we mentioned might be possible. We need to figure out more what's going on. And so he went for the CT scan, came back again. They just knew more. They thought they saw a shadow in the colon. So there was some thought that it might be colon cancer that had spread. Regardless, it was, you need to follow up. And we relied heavily on our relatives there who got us into Georgetown relatively quickly. And so, yeah, I can tell you more about that whole process if you're
Yeah,
interested.
tell us, because we always say, and by the way, for those watching again live or the replay, if you come to Blue Fairy, we will help you get a second opinion for free. I always encourage a second opinion. So talk to us a little bit about getting those second opinions, because I know you got more than one.
Sure. Yes. We weren't happy with what we heard from the Georgetown doctors. I mean, it did take a little while. Actually, there was a thought it might be testicular cancer, but when they got the biopsy back, it was obviously HCC. And there appeared to be portal vein involvement, which is, pretty deep detail, I guess. But, Georgetown was like, we don't have anyone who can do chemoembolization, which was a new word for me, right? So they recommended going to UPMC and Sloan Kettering. So we did both. We started at Sloan Kettering, saw a great doctor there, but he was mostly doing, I think, clinical trials. And this is where sort of the tension between Matt's medical family and sort of what I felt based on what I was reading online. They really were like, okay, what's the standard of care, right, for hepatocellular carcinoma at this time? And it's, the chemoembolization. So we went to UPMC and they were willing to do that. And so that's what we did. I was sort of looking for a silver bullet based on what I was reading about, the standard of care. You might get an extra 3 months or something. And we needed Matt for a long time, right? I mean, we had little kids. And so I was sort of looking for the Hail Mary, so to speak. But at any rate, yes. So we went to UPMC, and that's where we had a couple rounds of chemoembolization. A little bit further along, we went to MD Anderson in Texas. But by then, he was starting to show jaundice, and he was no longer a candidate for that clinical trial. I will say that I feel like the doctors, I kind of had to pull teeth a little bit, right, to hear about clinical trials, and did a lot of the research on my own at that time. I think it's better now, right, being able to find clinical trials, but it's really overwhelming because there's inclusion criteria, exclusion criteria. I mean, these things you've never really heard before, but I really tried to dig in to find some, and so that's kind of how it happened. We wanted a
Uh,
surgical solution, right? I mean, we wanted it taken out, but it was too far. gone by the time he had symptoms.
Um, let's go back to the chemoembolization. Did it help at all?
Yeah, it's a great question. The first time it seemed like, the follow-up CT scan had, there was some necrosis of the tumor. And I think his AFP did drop for the first one, the blood test.
Mhm.
But the second one, not so much. And by then they were seeing some metastasis to the lung. And that's when the first time actually that I feel like Matt and his family were like, okay, maybe we should look at clinical trials, right? That
Mhm.
are more like have a systemic solution, if that makes sense, not just, the chemo right into the liver. So
Right.
that's when we went to MD Anderson. But by then, like I said, he started to be jaundiced, which was, a exclusion criteria. I learned that word for the clinical trials.
And I just want to touch on a couple things for people who this is brand new information. Necrosis is the death of the tumor, the death of the tissue. AFP is alpha fetoprotein. Actually, Aura, if you could drop a link in the chat to our glossary, all these terms are in our glossary. Alpha fetoprotein is often elevated if you have HCC. But not always, but it often is. And in jaundice, of course, is when, I shouldn't say of course, now everybody knows, jaundice is when your liver begins to fail and you tend to turn yellow. And sometimes it's just in your eyes, sometimes it's your skin, your nails, but you really can see it. And it is often, like you said, an exclusion criteria because they know your liver is not healthy enough.
Yeah.
Um, when did hospice enter the picture, and what was that transition like for you and Matt and the rest of your family?
Well, it's so hard when you have a loved one and you're both trying to be positive for the other one, right? And, I think, everybody knows that hospice is not a good step, right? People do come out of hospice, but it's something that people associate with near the end, and it was very difficult to talk to Matt about that. And I feel like partly we didn't ask enough questions, maybe because we didn't want to know the answers. And I was doing a lot of research online, but clearly Matt was not ready to ask the kinds of questions. How much time do I have? You know what I mean? But it became obvious at one point, after we came back from MD Anderson, and he was having ascites, which is that fluid buildup in the abdomen area, and really uncomfortable. So I had to broach the topic. I also wanted hospice involved because of the kids. I thought they might be able to help me know what to say and how to prepare them. So they didn't get involved until 6 months. We did get, longer than some of the projections with that, liver cancer that far along. So it was in November. He was diagnosed in May, and it was in November. It was a Friday, and he died on Monday. He was
Yeah.
very strong. As a young person, I think, he was up and about the house. I'm not saying easily moving around, but and managing his own meds up until that Friday. And so we didn't get maybe the support that we should have. So, in hindsight, maybe I would have tried to bring them in earlier. But
Yeah,
hindsight's 2020.
but I think that's such valuable information to share because there are a lot of studies that show this, that too many people go into hospice too late. And they don't understand that you can leave hospice at any time. I mean, so if a clinical trial comes along, you can
Mhm.
leave hospice to do the clinical trial. There's nothing that prevents you from doing that. And hospice does give you so much extra support. And I do believe, I had this very similar situation. Hospice didn't come in, wasn't even broached as a topic until less
Mm.
than 3 days before Adrian died. I
So
never even heard,
similar.
I never heard the word, so I didn't
Mm.
know. Um, let's talk about your young kids.
Yeah.
What was it like helping your very young children understand what was happening to their dad?
Yeah. So obviously a very sensitive topic for me. You know, I really wanted to be very as upfront as possible with them. I mean, they're little, so you to try to tailor the conversation. But Matt, didn't want them to worry. And so there was a little bit of a tension over what we say. And but there came a point where I was like, I'm the one who's going to have to pick up the pieces here, right? Like, if this doesn't have a positive outlook. And so I was trying, but in hindsight, my oldest, who had turned 6 after the diagnosis and was so close to his dad,
Mm.
was shocked when he passed. And it took, he was in therapy later, and I think I just didn't use the right terminology, if that makes sense, right? I was like, daddy's not getting better. We've gone and to these different places, and the doctors have tried. It's just not working. But I think you need to say the words, right? I mean, in hindsight, daddy's dying. And I couldn't do it. So in hindsight, I wish I had been more clear. And then I had a 1-year-old who I really didn't talk to him much about it. And then, I think I've told you before, then a couple months later at Christmas, he died in November. At Christmas, he said to me, "When Dada be home?"
Oh,
And it's just a dagger to the heart, and so I told him, he's not coming back. He's not coming home, but he loves you. You're right. He's in heaven, uh, keeping an eye on you and that kind of thing. And I mean, surprisingly, he really seemed to understand, which, is kind of surprising. But, he would say at the dinner table, "There's someone missing," you know, and he meant daddy. And, but so I, feel like I messed that up, but I try to give myself some grace because it was just so difficult, right? And 6 months may sound like a long time, but it's not when you're in the fight for your loved one's life. And there's just a lot going on. So yeah, yeah.
I hope you do give yourself grace. And I think babies do understand. I just have
Yeah,
this,
yeah.
I have this theory that babies understand. My godson was born shortly a year after my sister died. And my best friend would tell me there were times where she was convinced that her baby was looking at my sister. Like her
Wow.
baby could see beyond.
Mm.
And because we had always joked that, hey, you need to watch over this little baby. So yeah, so thank you so much for sharing that. I was hoping you would share that very particular story. Um,
Yeah.
Cathy is going to be with us at the top of the hour for any questions you have. Um, Aura, would you please put Cathy backstage for now? And Cathy, again, thank you so much. And bring Azure Klein to the stage, please. Azure Klein. And Aura also put that question we talked about in the Q&A, the one that I'm going to ask everybody. So um,
Mm,
I'm very excited to introduce you to Azure. Azure is a single parent and a career technical professional. After a recent period of homelessness caused by the COVID pandemic, Azure has reestablished housing and gone back to school to finish their degree in software development. Azure's father always wanted to see them graduate from college, but HCC took that away. He passed in 2017. When not at work or handling school tasks, Azure can be found knitting or playing card games with their son. Azure, thank you so much for doing this. And you're coming at this from a different perspective. You're not the spouse, but you're the adult
yeah.
child. So let's start with your dad. What was his name? What was he like? What did he do?
Yeah, it's a awkward one. Yeah, my dad was somebody who worked very, very hard. One might even say a workaholic, but at the same time, he was a huge animal lover. And always moved out into the country and would get like all this land just so he could have all sorts of animals. And that would be his thing. Like after his really long day at work, he would come home and spend literal hours feeding all the different animals. It wasn't quite a farm, but there was definitely just animals everywhere. And he always had a pun or a joke in his back pocket. That was his primary way of relating with human beings. He would have the serious conversations with the chickens and then would have his stack of jokes for talking to the human beings. There's actually videos on his Google of just him chit-chatting with the chickens. It's wild. Sorry, you did mention his name was Bill.
And
Uh
what did he do? Because I know he was pretty brilliant.
Yes, he was an electronic engineer. Actually, at the height of his career, he actually was the director of R&D at Nokia when the famous candy bar phone that basically everybody had in the mid
I had
90s.
one.
He actually designed that. Yeah, the one that you can drop from the top of Tandy Tower and it'll still work. Yeah,
I had that candy
it's
bar
inspired
phone.
tons of memes. Yeah, exactly. Most people did. Most people did. There were a lot fewer phones to choose from at the time. So yeah, the 3310, that was his baby. My actual dream was that, I was going to be a programmer, he was going to be a hardware engineer, and we would make something together where he made the hardware and I made the software. It just, didn't quite pan out that
Oh
way.
gosh.
But
Um, was your dad generally healthy, but before it began, like, were there any early signs that something might be wrong?
not that I know of, but he was a very stoic man. So again, he didn't really share his feelings with people very much. He wouldn't really mention when he was sick, and when he was obviously sick, like he would still go to work. We'd be like, "Why don't you take a day off?" It's like, "If I'm going to feel bad, I may as well feel bad and get paid for it." I'm like, okay, but rest would help. So like he would never ever call out sick, and he would always hide when he was sick. So we didn't have any clue really that anything was going on until he was having some digestive issues uh well, to be blunt, messes, accidents, uh and
And
that
and
sort
then
of
he-
thing.
and then he also had his gallbladder removed, right? That was kind of the
Yes.
beginning of the surgeries and things.
Because at first they thought the gallbladder was the whole problem. He was having digestive
Mm.
issues. They weren't going away with normal treatment. They noticed some inflammation. And then so yeah, they removed the gallbladder. And of course, I wasn't there at the time because, I'm his adult kid. I wasn't living there. So all I knew was that his wife at the time was cleaning up when he was having bathroom accidents, and there was something going on, and all of a sudden I get a message that says, "Hey, I'm in surgery. I'm gonna get my gallbladder removed here in about an hour." Like he was in his gown and everything, sent me a selfie. I'm like, "You got to put your phone away, bro." And I was like, "Okay, cool. We're gonna have matching gallbladder removal scars because I had mine removed, just a couple years prior. So I didn't really think anything of it because I wasn't, in the thick of it every day, and he wasn't telling anybody.
So what
So,
what happened with the gallbladder surgery and what did the doctors find?
that's the curious part because the timeline of when he found out and when the rest of us found out is a little bit different.
Right.
But essentially, they did the gallbladder surgery, but while they were in there, they noticed something very suspicious looking on the liver. And since they were already in there, they took a tissue sample, decided to do a biopsy. And of course, the biopsy results came in and confirmed that there is, in fact, cancer present, um, which we didn't find out for I think a couple of months after that. I'm still rough with the timeline and all that. Um,
Because he didn't tell you.
exactly.
Mm.
He didn't mention any of that. All we knew was that he was continuing to get sick even after the surgery, and it was weird. He stopped being able to speak as much. Like his speech became really difficult to understand, and we would ask, it's like, "Oh yeah, it's just from the tube from when I had the gallbladder surgery. It'll be fine." I'm like, okay, but you also seem more tired than usual. Like what's going on? It's like, oh, I'm just getting older. It's nothing to worry about. So it yeah, it was very disconcerting because we had so little of the information. He knew he had cancer, but we didn't yet.
Mm.
Um, and
Do you think your stepmom knew? I'm just curious.
No, she did not. We spoke. She found out the
Mm.
same time I did. We suspected he had cancer because there was one day, it was actually his birthday, uh, in 2017. She was like, "Hey, weird thing happened. Your dad's MRI randomly got canceled." And I was trying to figure out why that happened. And I was like, "I don't know." It's like, "Well, your dad said that they just didn't need it anymore." I'm like, "That's weird." So we did what, women do. And we got to Google and started looking up his doctor and trying to figure out more about, why the doctors might be ordering an MRI, what could be going on. And she found out that his primary doctor that he had been working with for, you know, ever since the gallbladder removal was an oncologist. So we were like, that's suspicious. Does he double his other gastro stuff? What's going on? So we suspected the cancer, but we didn't know until he was jaundiced one day, and we basically forced him into the ER to get the
Tell,
MRI that was allegedly canceled.
tell us what happened in that ER visit, because I know a lot occurred.
Oh gosh, and it's all a blur too, because it was a very, very short time period. In the ER, we did manage to get the MRI. And the results came back. The doctor came in, looked over the MRI, and goes, "Oh, well, yeah, all of this makes perfect sense because of your cancer, right?" And Iris, my stepmom and I and my sister just kind of all stared at each other and were like, "I'm sorry, what?" Uh, and then he just turned and looked like right at my dad and was like, "You didn't know you had cancer, right?" And then my dad just stared off into space, didn't even like respond at all. That was something that was happening to him a lot. He was just kind of spacing out. I don't know if it was stress or what. And so he didn't say anything, but the rest of us were like, "Oh my God, that's why his doctor's an oncologist."
Yeah. Yeah.
Uh,
I do wonder, just the disorientation stuff. It just sounds a lot like hepatic encephalopathy that or HE for
yeah.
short. And again, if Aura's put the glossary link in our chat, you can look that up. But again, doesn't happen to everybody who gets liver cancer, but it can. And what it means is because of the cancer in your liver is not able to detoxify, which is your liver's entire job. And so too much
Hmm.
ammonia goes into your brain. It makes you disoriented.
Okay.
It makes you forgetful. It can make people very, very combative. I've heard all kinds of stories of people who had HE and their relatives that were ready to lock them up because they're like, "What's going on with this person?" So it really just could have been something like that. So
Oh
you
my
you
gosh, that
find
actually helps a lot.
it does?
Yeah, I didn't realize that was like a thing that happens. Because yeah, at one point when he was in the ER, I had my sister flew in from California because we were in Texas at the time, and he was like, "Who is this?" I'm like, "It's Missy. Like, how do you not recognize your own sister?" It's like, "Oh, well, that's not really my kid." I'm like, "Dude, I've known her since I was 4. This is definitely your kid." Like, it was very odd. So
That's
that
that's
makes sense if
HE.
there was some weird brain involvement.
Yeah, and it's not tumor spreading to the brain, it's the ammonia building up in the
Right.
brain. Yeah. Um, when that truth came out, right there in the hospital with you and Iris and your sister, I mean, how
Hmm.
did you cope with the diagnosis? What did you think?
We leaned on each other a lot. It wasn't as serious for me as it was for everybody else at first because my mother also has had cancer,
Hmm.
like several of them since I was 5, and she always got better. So I didn't immediately make the jump from cancer to dying,
Mm.
because in my experience, mom gets cancer, mom goes to the hospital, they treat her, she comes back out, and that had been happening since I was 5. That quickly changed the next time we met with the doctor, and my dad kept turning yellow more and more, and continued to degrade. And then they told us, they're like, "Look, he only has a couple of weeks left," which they were sadly very wrong about. From ER to his passing was only about 4 days, maybe four and a
Oh
half.
my goodness. Oh my gosh. What were those final days like for you and him?
Um, Very long. A lot of it was spent once he no longer was able to swallow anymore. We had to essentially suction the saliva out of his mouth for him so he didn't choke on it. And then, of course, there was, the regular cleaning stuff that the doctors had to do. Eventually, he couldn't hold the urinal thingy to go to the bathroom anymore, so we had to make the decision to put a catheter in. He despised it, but he couldn't handle it himself. He wasn't able to walk by the time we got him there, but he couldn't even use the handheld restroom there towards the end. He was essentially just laying there and just upset. He kept refusing pain meds, and eventually we had to take power of attorney from him.
Oh goodness.
I forget the legal process of how that happened, but Iris was able to take over his medical control because he kept refusing meds, and the brain stuff wasn't all working so well anymore.
Yeah.
So we did finally get him on pain meds and some anti-anxiety meds, and that helped some, but not as much as we would have liked. So it was really, really rough seeing the strongest man I've ever known in, very obvious pain and not able to do much about it.
Oh, one last question for you, Azure,
Hmm.
before we welcome our next panelist. Looking back, why do you think your dad, Bill, kept that diagnosis to himself?
I think part of it is cultural, not just his age, but also just the fact that he was a man that grew up in his time period. Very much they didn't always talk to other people about their feelings or when they're sick. It was that very much that mentality of you just suck it up and you live with it. Life hurts. People get sick, it's fine, whatever. And he just pushed through it and didn't want to talk to anybody because he didn't want to bother anybody with it. Uh,
Oh, gosh.
yeah.
Well, I am so glad. You and I have known each other a long time, and I really
Yeah.
appreciate you sharing your story. So Azure's going to be back when we have our entire panel. And so we're going to say goodbye to Azure for right now. We're going to welcome Karen Wright to the stage. So, or if you could bring Karen up. And let me tell you about Karen. After recently losing her husband to HCC, Karen is slowly adjusting and redefining her life without the presence of her anchor, Michael. Being a caregiver is complex and at times challenging. However, there is beauty in being able to hold space for someone and provide support physically and emotionally. Karen believes there's a lesson in all experiences, and she wants to share and help those going through a similar journey. Karen works for a national insurance carrier, holding various roles over the past 23 years. And together, she and Michael share 4 children and 11 grandchildren. Karen, I'm so glad you joined us. I'm going to go back to the beginning. Please tell us, how did you and Michael meet?
Yeah, it's quite a funny story. So he was on a flight and he sat next to a friend of mine. And I guess his usual way of being very chatty was chatting her up. And she decided that we would be a good match. So she came back. They were flying back to Atlanta and connected us. We met on a blind date and we were together ever since. So, yeah, unusual way to connect. Well, maybe not so much anyway.
Maybe not. I
No.
met my husband on a blind date, so I love it. I love it.
Yeah.
Um, Tell us a little bit about your relationship with Michael and what life was like before he was diagnosed.
Yeah. So Michael was one of the I don't want to call him old school, but very traditional. Liked to be head of household, took care of everything. He was truly, truly my trusted partner. There's always that person who you can call them in the middle of the night. I mean, is he going to fuss and quarrel? Yes, but he will be there to take care of me and make sure that everything is good. So it was like that. I mean, we had a good time. We enjoyed traveling. He enjoyed working a lot, which to me was like, why? But he really, really, really was
What did he
passionate.
do for work?
He was a healthcare administrator and he was very passionate about what he did. But during his funeral, his former pastor just spoke about his life much, much when he was much, much younger. And it really made me, at that point, appreciate and understand the hurdles that he overcame to become a healthcare administrator. And I got to see why he was so passionate about it and why it meant so much to him.
Oh,
Yeah.
that's so
Yeah.
sweet. When did you first realize something was wrong with Michael's health?
Well, he's one of those who's going to push through and not complain. So it's really hard to identify sometimes. But he had a couple of incidences where he was hospitalized due to some GI concerns, GI bleeds, varices, I guess is basically the term. So after that, he was followed by a GI doctor and did a couple of procedures related to his gastrointestinal concerns. But that doctor was very diligent about testing his AFP levels every 6 months. So the first 6 months they were fine, and by July of 22, the number had escalated or elevated right off the charts, essentially, to the point where they stopped counting.
So what did his doctor do then when he saw these really spiked AFP levels?
Yeah, so forwarded, we went to, or we referred to an oncologist within the same practice. Did that, and he did not do a biopsy. You know, they just felt, just based on all of the other factors, that it was definitely HCC. So
Okay. Was a transplant ever an option?
it was not for him because he had some other comorbidities, and it was an age concern as well at some point. Yeah.
That's right. They do have a
Mm-hmm.
cutoff
Mm-hmm.
for transplant. So what treatment plan did the doctors come up with?
So the chemoembolization was the first line of defense, I guess. So there was the Y90 and then another one. And we were pretty optimistic about that because he had two tumors. So it sounded good to me that you just go right in directly, shoot it in, and it should work. So that was the mindset that we went into it with. And, the procedure in and of itself it was a little challenging and a little rough for him, but within a couple of days, he was basically back to himself. So we were just waiting to see what the results would be after he had the treatment. He actually had 4 of them.
And what were the results?
Well, one shrunk till it was no longer, I forgot the term that they used, but no longer able to, it was too small for evaluation, but the other one grew. And there was some portal vein interaction as well, so it was tricky to treat that one.
What was Michael's attitude going through this? I'm just really curious.
So he wasn't very good with sharing his feelings as it relates to things like this, but he was, because of his healthcare work, you either see the good or the not so good. And he was on the good path of that. He felt he would be okay. His mother had various types of cancers for over 30 years, right? More than one. So I think in his mind, he would be kind of similar to her. It would go through, he would beat this, and they would be able to treat it, and that he would, be okay. He would always say he's never been sick. He never expected to be sick. That was always his first sentence. Well, we just
There are
never
quite some
know.
similarities between Michael and Azure's father and
Mm-hmm.
Azure's mother surviving
Mm-hmm.
cancer multiple times.
Mm-hmm.
Was there a moment that Michael decided to stop treatment? And if so, like, how did you cope as his spouse and caregiver?
So we did about a year, well, around 4 rounds of the embolization. We did a full year of systemic chemotherapy. And there were more tumors at the end than when he started. The oncologist said, well, there's these pills, but, the rate of efficacy is not really that great. You could try those, or we could try something else. The other therapy that he tried just did not agree with him. That HE is definitely something that is real, and it can be really scary to watch somebody go from they were fine and then all of a sudden they have no idea what's going on. They don't even know where the restroom is in their own home. And then, the doctor did warn me, which was a good thing. If he acts out of his normal character, then that's something to look out for. If he gets combative, then that is a sign that, his ammonia level is increasing. So after that second type of chemo, his ammonia levels did increase, and he was hospitalized for like 4 days as a result of that, trying to get it down. And then he just said he didn't want to continue treatment if it was going to be that he was going to be basically sick all of the time.
Yeah, I don't blame him. Is that when hospice was brought up?
So, but he seemed fine, with, well, in the scheme of things. Yeah, so he was in hospice for about 14 months, actually. So he started out,
Can you say that one more time? Because people need to hear that. I
yeah,
think it
he was
actually will
in there
help
for
people.
14 months. And what we do is like what some of the people, and you said that you got on too late. I wonder if we were in there too early. But it was very helpful. But I think we spent a lot of time kind of waiting for, is the shoe gonna drop? When is it gonna drop? And if you tell people he's in hospice, they came with an expectation
Mm,
that he was not looking like how they expected him to look or anything like that. But we developed some relationships. I mean, his nurse was with him for a whole year. We saw her more than we saw anybody else. So
oh,
yeah, but he was 14 months.
I love that. I love hearing positive hospice stories, and I also just it helps educate people about hospice that yes, to be put into hospice, you're supposed to technically, and it is a sort of a prescription. Doctors assess that you have 6 months or less to live, but
Exactly.
but Michael, 14 months, and
Exactly.
people tend to do really well on hospice and feel good. What were those final weeks like with Michael?
He got pneumonia. So I think that, the treatment for that, and then they changed his pain meds, and somewhere between or a combination of, I think the HE really started to take over.
Hmm.
And he was, just talking out of his head, just saying all kinds of stuff. He wanted to go. He would pack up all of his stuff and, try to leave. And so we would walk around the neighborhood and just come back home. And then that might have been 2 weeks out of. And then the last week, he just kind of laid down and never really, really got back up until the day before his birthday. He was up and talking, and he didn't want to be in the hospital bed. He wanted to be in the bed. So we said, okay, well, maybe he's getting better. When you think about it and you reflect on it, it was like, what was I thinking? But we really thought he was getting better. And he passed away the next day on his birthday.
Oh,
Yeah.
goodness. I haven't said this enough to everyone so far. I'm so sorry for your loss. And also what you just said is very common too, to have this sort of burst of energy.
Mm-hmm.
Sometimes within just a few days before you die can happen. And I know there's an actual term for it, but I can't remember what it is. But Karen, thank you so much for
Thank you.
sharing Michael's story. And Karen's going to come back at the top of the hour for the Q&A. We are going to welcome Julie Montoya to the stage. Or if you could bring Julie on. Julie is a former business owner, professional hairstylist, and watercolor artist. She is currently a full-time caregiver to her husband, Mike, who is battling hepatocellular carcinoma, again, also known as HCC. As a mother and grandmother, Julie deeply values connection and is known for her genuine care and compassion for others. She strives to be a strong support for those walking difficult paths. Inspired by nature, she uses her creativity to craft thoughtful gifts that bring comfort to cancer patients. Julie, thank you so much for joining us. Let's start the same question that I gave Karen. Tell us a little bit about you and Mike. How did you meet?
I know you were going to say that because we're on a meeting on a blind date roll here. Yes, we met on a blind date, and that was back in the 70s, so those will stay in the 70s. And years later, we got married, we met up again. He was always my crush.
He
So,
was.
yeah, he was. I admit that.
Oh,
He,
that's so.
I don't think he took me as seriously, but years later, then it kind of happened and we got married.
Oh my goodness. What was Mike's health like before his liver cancer diagnosis?
Well, in our journey, there was a serious problem that arose. And the way that we found out about it was through blood tests for a life insurance after he got a really good job. And we had had our children, and they offered, life insurance. So he took blood tests, and we thought everything was fine, and it came back denied. And it turned out that there was something going on with his liver. So it turned out that he had hepatitis C. So that led to a lot of, watching his liver. I mean, things seemed like it was fine, and it was fine for a lot of years.
Okay. Was he, and that watching you're talking about, just for people, doctors call it surveillance. So if they
Right.
know you have underlying liver disease and you have good doctors, they will put you on surveillance where typically twice a year they'll do blood work and a scan. Now the type of scan can vary, but typically that's what they do. Did he ever get treatment for the hepatitis C?
Yeah, years later, we happened to talk to some doctors, and they had come out with some, better options. And so he did try the first time, and he did a whole treatment. I don't know if you want me to say the name of the drugs that he used, but
I don't care.
yeah, it was the ribavirin and the Zivaldi, and it was a 12-week course. And he did great, but after 3 months, when they did the follow-up, they found that it failed. So that was 2015, and some gastro doctors again approached him in 2017 to try again. And we were kind of reluctant to do that because it had been a tough journey, and he became a diabetic. So I don't know if that was a side effect of that whole thing. But we said, okay. And this doctor was really good. He said, well, before we do anything, let's check his liver one more time.
Right.
And so when they looked, there was something, they saw something. And he said, I'm just feeling like this is something. I mean, we were kind of like, what? This can't be. But they sent us to an oncologist, and they did scans, and then he had a biopsy. And yeah, it was HCC.
Was HCC.
Yeah,
What year did he get that diagnosis?
2017.
2017.
Right.
And what was your reaction when you heard the news and his reaction?
I think he took it better than I did. I think I was shocked. I think, well, let me just say, there was still hope at that point because
Yes.
it was still in the liver, and it was small. And at the time, he was eligible for what was called an ablation, which is when they go in and burn it. They
Right.
take it out. And, I thought, wow, that's amazing. And it was, except for there was some complications because there was, during the time when they were biopsying it, they actually uh, caused an aneurysm. So on the day of the surgery, when they were going to do the ablation and remove his gallbladder, they had to back out because there was blood. And so they wound up doing a chemoembolization and some stuff to dry up the blood, and then turn around and go back. And so it was like 2 surgeries really quick. It was kind of grueling to go through, but they did everything. And I will say for years, he was checking out really good. We had gone through the 5-year mark
So
after
the
that.
ablation worked.
It did. It did.
Fantastic. Okay, continue.
That's 3 centimeters or less, maybe 4. So people that have that option, it is a good option. And so I think he went 6 or 7 years before it was 2023 when he had the last scan, and there was something. And the doctors said it was nothing. And that was when a really bad call was made. So I think for anyone that's out there, you really need to double check. You really need to be sure. If there's something in your gut that's telling you this doesn't sound right, double check, because we were sent on a wild goose chase. She thought it was something orthopedic with a hip replacement that he had had, but there was a mass on the bone.
Mm.
And that wound up going to 9 centimeters. So now the cancer was at stage 4.
I want to go back to that ablation and ask you, did they tell you that HCC comes back more than 50% of the time?
I asked her, I said, what are the chances? And she told me 70-30.
Okay.
You have a 30% chance that this won't come back. I mean, I don't know. I just remember her saying that. I just remember I wasn't too good, but it was something. And you're still hopeful. You're still thinking maybe there's a chance. This was really small. This may have gone away, you know. And sometimes I guess it does. Sometimes you beat it. Sometimes you're eligible for a liver transplant, things that he wasn't eligible for. So I don't know. At the time, we were hopeful, and it was good for 6 years. He was clean. We kind of met the milestones. We felt like we were out of the woods, but it was lurking. And I kind of knew things were lurking. He'd been losing weight.
Mm.
He had pain. He was getting weaker. I just didn't have a confirmation.
Got it. And I do want to just share with people, we do have if you look on our YouTube list, A Truth About Liver Cancer, specifically on liver transplant. It is the most curative treatment for HCC. I know some oncologists might argue with me on that, but kind of across the board, it is. And we have a story coming up next about a liver transplant. And also with HCC, when it spreads, it does typically spread to the lung or bones or both. And as you said, it was mistaken, the bone mass. Do you feel like the doctors and the care team, you finally get the actual diagnosis, after 6 years of being clean, as you said, it does come back in his bones somewhat aggressively, it sounds like. Do you feel like they communicated well with you?
Well, I feel there was a lot of changes in healthcare after COVID. There was a lot of things that he couldn't get in to be seen. I felt like they were letting too much time go by. And then our doctor, our oncologist, was retiring. And she was the last person to talk to us. And she saw the mass and she said, she ran some markers and she just said, "No, I'm pretty 90% sure this is nothing." And so we were really happy. This was Christmas time. This was the end of the year. I didn't want bad news for the new year. I was hoping, and then the pain just continued. The ability to get back in to see someone else was hard because now your doctor left. The other doctor, we're in January. He doesn't want to see us till August. And we're frightened. So we go to the GP. He is really helpful, orders a MRI to confirm. And that's how we got back in to start some kind of treatment or find out. But no, I don't feel they did a good job. I don't feel in the beginning they even offered immunotherapy for months.
I'm so sorry. So many people were not diagnosed because of the COVID restrictions, and so many cancers were missed. And how is Mike doing today?
Well, we're in the thick of it. We are in the thick of it. He's getting weaker. He's lost a lot of weight. I mean, he's so low in weight, if I told you, you wouldn't believe it. But he's strong, and I practice what I call nutritious espionage, where I let him have a treat, but he doesn't know it's packed with, some something good for him that he would normally say, I'm not going to eat that. So I feel like he really tries to make the best of each day. And what's so painful, I don't know about other cancers, but I do know that when it goes into the bone, you're miserable. It just hurts all day and all night, and there's no relief. So you're doing pain management, you're caring, you have to help them up, you have to help them get dressed, you have to help them get out of bed. I mean, right now is that time in life that you just have to be present, you know, you have to be there.
Oh, Julie, thank you so much. Julie's going to be right back with us. We're going to go a little over the top of the hour because we have one more panelist to share her story. So, Aura, would you please bring Ashley Binggeli to the stage? Ashley is an experienced ER nurse with over 15 years in the field. She's also the mother of a childhood cancer survivor whose diagnosis 5 years ago gave her healthcare career a deeply personal perspective. Navigating the world of pediatric oncology as both a medical professional and a parent opened her eyes to the many challenges families face after a cancer diagnosis. Ashley is passionate about raising awareness, supporting others, and advocating for improved treatments in pediatric oncology. Ashley, thank you so much. This is the second workshop you've done with us. It's been some time.
Yeah.
And you have a very different story because you are the parent of a child. And I want to make it very clear for people who had HCC, not hepatoblastoma, which is a pediatric type of liver cancer that happens in children ages 5 or younger. So would you take us back to the beginning of how old Presley was when things first started and what was going on?
So Presley was 14 at the time, and it was right at the start of COVID. It was kind of when they had shut down the school and stuff, wanted kids to stay home. I happened to be at work. She called me and said, her story is very different. So she called me and said that she actually had some urinary symptoms, some, blood in her urine. So I thought that was very odd. And because she was never a very healthy child, never got sick, never went to the pediatrician, didn't take medications, very active year round in multiple sports, played all stars. So we got her into the pediatrician that day, and I was able to meet her at the office. And when she provided the sample to the doctor, I was like shocked because it was so dark red. It almost looked like a red drink, a Kool-Aid. And I was like, oh my goodness, like what is going on? Doctor thought right away, that it was a urine infection. So she started her on medications. We went home. I was expecting her to be pretty sick with like maybe a fever and stuff like that, but she never got sick. And she had just had that one kind of incident or episode of the blood in her urine. And then the doctor had called the next day and said that there was no infection. There was no bacteria when they sent it off for testing to the lab. So that's kind of how everything started with Presley.
Did the symptoms ever come back? Did the urine issues?
No, she only had one time. She had the very dark red urine. She didn't have any regular symptoms of a UTI, which is what I thought she had, and it would have been her very first one. So I thought it would have been a pretty severe with like maybe some fevers or vomiting or stuff like that, but she never had any of that. It cleared up, never came back. And that's when the doc called us and said, hey, there's no infection. You can stop the antibiotics.
So what led you to believe that something more serious was wrong?
So it was probably a couple days after that, my mom brain just started spinning. And I just thought, this is really odd. I guess we just didn't have a reason why she had such a significant amount of blood in her urine. And then I just started to go down the rabbit hole and thinking, oh my goodness, she's got a virus, something's wrong with her kidneys, anything that I could think of. And especially being in the healthcare field, I probably went even deeper down the rabbit hole. And so I reached back out to her pediatrician, who was great. And I just said, hey, can we kind of maybe look into her kidneys and maybe check some blood work or something like that? And her pediatrician said, absolutely, so she ordered some blood work and then ended up ordering an ultrasound of Presley's kidneys to see if she had maybe like some growths or some cysts or something to kind of explain that significant amount of blood in her urine. And then was, I want to say, April of 2020. And because of COVID, Presley wasn't able to get into have her ultrasound done until June of 2020.
And did it show anything on her kidneys?
No, Presley's blood work was beautiful. Everything was completely normal. There was not a single number that was elevated or out of range, and her kidneys were beautiful, perfect. But what they found when they were actually doing her kidneys was they found a large tumor on her liver. And that's kind of what just catapulted everything, and we just took off from there.
So what was the next step in terms of testing and getting a diagnosis?
So I was in shock. I, had no idea that, obviously Presley had anything on her liver or anything wrong. She wasn't sick. She wasn't losing weight. She wasn't nauseous. She wasn't vomiting. Nothing was wrong with her. And the ultrasound, I believe the ultrasound of that liver initially thought that maybe it was a cyst, if I remember correctly. But she needed further follow-up and she needed an MRI. So that was the next step. So we got an MRI on her after that initial ultrasound, and it showed a large tumor in her liver and a bunch of baby tumors around it.
At that point, had you heard the term liver cancer?
Never. It was a huge eye opener, and we still didn't even, I had no idea, nor was I even thinking that my daughter had liver cancer.
Did the oncologist use that term?
No, not initially. I thought that Presley needed to go and see a gastroenterologist. I thought that something was going on with her liver, not cancer at all. I'm telling you, she's like the healthiest kid. And so I kept trying to call gastroenterology and get her in, and I wanted to make sure that it was a cyst or that it was a little fatty tumor or something, and nothing was going to happen. And they referred me to an oncologist at our local hospital, and I just kept thinking to myself, for what? Why do I need to see an oncologist? I need to see, a doctor that specializes in the liver. We need to figure out what it is. So,
I think your background in healthcare, right, really helped you, right? Because you didn't give up and you kept going. And I know you got a second opinion. When did you finally receive an actual diagnosis?
So we actually got a diagnosis. We left our where we live locally. I just didn't feel that the hospital that we were seeing at first was the right fit for Presley. I needed, a larger, more comprehensive, where everybody, it's a huge hospital. So I opted to take Presley to CHOP. And so we did not have a biopsy. We didn't have anything. We did not have a diagnosis until we relocated to CHOP.
And CHOP is, for people, it's Children's Hospital of Pennsylvania. Very well known, one of the top children's hospitals in the country. And you relocated across the country because I know you live in San Diego.
Yes.
When you got to CHOP, what were the series of tests they did?
So the very first thing they did, which I learned later on, was they did a CT of her chest, a big x-ray of her chest, and they wanted to make sure that she didn't have any type of cancer or anything in her chest, because my understanding is that one of the number one metastasis sites is to the chest. So that was the first step. That was clear. And then we went in for a biopsy. We needed to know exactly what it was. So she had a biopsy, and it took I'm not sure exactly how long, but it took a little bit of time to get that confirmation back that it was actually hepatocellular carcinoma.
And what did they do in terms of treatment to begin with?
So at first, originally, they thought they would be able just to do a resection, I believe it's called, because it was mostly on the right side. But when Presley ended up having a PET scan to see if there was any signs of it anywhere else, my understanding, what I was told, was that it had started to affect the left side of the liver. And so that at that time, they opted for Presley to have a whole liver transplant. It was still completely confined to the liver and just starting to show up on the left side. But there was no lymph nodes, there was no portal vein involvement. It was just all isolated to the liver.
And I'm glad you pointed that out, because that's one of the tough things about getting even on the transplant list is you have to be sick enough. So you have to have enough tumors, you have to have a serious diagnosis. But you also have to be healthy enough to survive the transplant. And so oftentimes people, yeah, if you have portal vein invasion, or you're over a certain age, or you have underlying liver disease, so many things can exclude you from even being eligible for liver transplant. But here is Presley, who is a very, like you said, young, healthy, active teenager, no underlying liver disease, and kind of the ideal candidate. So tell us about the liver transplant and what was that like for her?
Presley is, I have to say she's very mature. And we kind of went through everything, and she just kind of rolled with everything that was kind of given to her. It was almost surreal to her, is what she told me. She just almost couldn't believe it because she didn't feel anything. She almost, not that she wanted to, but she almost wanted to feel something, if that makes sense. I need to know that I'm sick. I need to know that I have a stomach ache, to fit this box of being a severe, liver cancer patient. So we got a call, and it's almost kind of like the movies where you get a call super early in the morning, you head straight down there. They literally prepare you and prep you. She went into the operating room, I want to say for about 6 or 8 hours. They completed the transplant, and that was August of 2020.
Did she have any follow-up treatment after that transplant?
No, actually, no. Presley had the transplant. She did actually have chemo, excuse me. I'm not exactly sure what it's called, but because Presley doesn't have a so-called reason for her liver cancer, they don't have an answer, if that makes sense.
Right.
She has no underlying, liver disease or anything. She was put into the, I believe it was 4 rounds of chemo after the transplant, to kind of go in and sweep up any micro mets that might be around, is my understanding. So she did have that.
And I know this because I follow her on Instagram, but I really wanted to end our panel before we do the Q&A on a really hopeful note for people. How is Presley doing today? And how are you doing as family?
Yeah, she's great. She is a very typical 19-year-old. She works and she is in school. She's in college right now for nursing.
I love it.
Yeah, but she's great. Things couldn't be better for her. Like I said, this month, actually tomorrow, is the actual date. August 3rd, 2020 is the date of her transplant. So
Oh,
she's
no,
done
really?
beautiful. Yeah, she's done amazing. Her liver has been amazing. She hasn't had setbacks or anything, and we're just beyond blessed. We really are.
Oh my gosh, that's so wonderful. All right, so we are going to bring all of the panelists back to the stage. So Aura, if you would go ahead and launch the poll. So we have a poll, which I believe our panelists can participate in. But if you would go ahead and launch that poll for everybody, I'm going to put us in gallery view so we can see everybody. And Aura, just let me know when that poll is launched. And so here it is. After participating in the workshop, what changes regarding liver cancer care do you plan to make within the next 1 to 3 months? You can check any that apply. Seek out support from Blue Faery or other patient advocacy groups. And we are going to put some links in the chat for you. Join a community for liver cancer patients and caregivers, such as Blue Faery's liver cancer community. Talk to a mental health professional or other healthcare provider, or and read educational materials about liver cancer. So we're going to give a few more minutes for the poll. Thank you so much, you guys, for participating. I see about half of you have so far. That's terrific. So what I'm going to do is I'm going to ask all of our panelists the same question. And I saved it because I know it's sort of a different answer for all of you. And Ashley, I'll start with you, just because I see you at the top of my screen and your name starts with an A. So we'll go to Azure next. I'll just do it in alphabetical order because Zoom is going to move everybody around.
Yeah.
So Ashley, what advice do you have for parents whose children have something seriously wrong with them, like liver cancer?
What advice do I have for them? You know what? Honestly, you are probably their number one support person. Days get rough and you guys might not always agree and stuff, but Presley even speaks about it now. The fact that I was there for her through every single step just really speaks volumes to her. And I know it's tough, and as tough as it was for her, it was very hard. I'm getting emotional. It was very hard for me to watch my own child suffer. So, but I would always be there for her, and she knows that. And she'll even attest to it today. She's like, oh, my mom. But yeah, it was difficult, and just know that you're their biggest support person.
Yeah, you have to fight for them. Azure, what advice do you have for people whose parents have a liver cancer diagnosis, knowing what you know now?
Uh, Gosh, yeah, knowing what I know now, the testing is the most important thing you can do because a lot of times the the doctors only get so much time with your loved one, whereas you're with them 24/7. So you may know things that don't necessarily get mentioned in the exams. So advocating for them becomes a really, really big thing. There may be things that are available to you that won't be mentioned unless you go looking for it. So it is very much an active role. You can't just sit there and just take what the doctors tell you and then go home.
Mhm.
There's a lot of behind the scenes work and research that goes into it too.
Thank you so much. And before I move on to Cathy, same question, similar question. Or would you please put the community, Blue Fairies community, the link to our webpage talking about it in the chat. Both Azure and Cathy are former moderators of our community and volunteers for Blue Fairy. So Cathy, uh, spouse, but also young children. So what advice do you have for someone who is in your situation?
Well, I would say let people help you. I mean, the community really rallied around us, our new neighbors, family and friends. They all feel helpless and they really want to help. And, I think I had felt that way about other people before too. So I was like, without that, I don't know what we would have done. The meals, the helping with the childcare, getting into activities, just around the house kind of things. And, I would, mention that what the other two have as well, which is, you are their main advocate. They're feeling so unwell that they can't really do it for themselves. So, doing the research, trying to get answers. If anything, I feel like I wish we had asked some more questions more directly so that we had been better prepared, but it's hard, right? When you're not sure you want to hear the answer, maybe. So
I agree, and it's interesting. There's some critique of my book about how I didn't ask about hospice or palliative care, and I didn't even know to ask.
right.
I didn't know.
Yes.
I didn't know. So Julie, you're living this right now. This is your husband. I love that we have Mike and Michael, by the way, for you and Karen. What advice do you have for spouses whose spouse has liver cancer?
Well, you're going to be the chief cook and bottle washer. You're going to have to endure. You're going to see suffering and you're going to feel grief. You're going to feel the grief every day as a caregiver. I think it's the beginning of the journey of saying goodbye. It's the end. You're going to need, if you're a person like me, at least I have hobbies. I find joy in creating, being an artist, mixed media, you name it. I have an art room right now that would spin your head.
I love it.
Everything
That's
that
great.
I do and all my projects. So that's really helpful to me in the time when I can take that mental vacation. Have friends with big shoulders. If you do, that's great. You'll need them. And a support person like Sarah, because she was my guiding light from the beginning, and she saved me in so many ways. I have a million thanks for her.
I think you and Karen have her in common.
Oh,
Yeah.
So Karen, same question to you. What advice would you give to spouses whose loved ones have liver cancer?
Yeah, definitely. So a lot of the same things, but I was going through my phone and I found a quote or an affirmation that I was saying during the time, and it was, may I adjust my focus from looking towards looking for light at the end of the tunnel to looking for the light to guide me through the tunnel. And what it resonated with me was just taking the time to enjoy the moment. As difficult as things were, like we were able to go out for a picnic, and he just didn't want to do the picnic before. I had this picnic basket and I was so excited, and he was not, apparently. But we went, and it's difficult because, as Julie said, it's not just the pictures will show one thing, but it's helping him to get dressed, helping him to get to the car, walking from the car to the thing. So just really trying to focus on making those memories. And I had I call them the F's of finding your community, so important because it can be really isolating. And I think sometimes you just don't really want to talk about it anymore. You just don't really want to, even though you need to. But it felt like I don't want to weigh anybody down,
Yeah.
and that was something I should not have done. So I would not recommend that. Let's put it that way.
And you made me think of something. So, and since we have 3 panelists here in California, a friend doing research found this for us. This did not come from the hospital or the social worker, but there's a program, and I think most states have something similar. In California, it's called In-Home Supportive Services. And the social worker didn't bring it to my attention because she said, well, you won't qualify. And I'm like, how would I not qualify? I quit my job to take care of my sister full time. How would I? And I didn't make a lot of money to begin with. How would we not qualify? But what my sister and I both found extremely amusing about it was they did this calculation of how much time I spent every week doing dishes, running her bath, making her meals, taking her to doctor's appointments. And we laugh so hard at these calculations because you can't actually get paid for all the hours you do those things. And we were kind of like, you would have to be superhuman or on speed to actually be able to wash dishes for only 30 minutes the entire week. Things like that. It was so funny. Plus, she got to sign my paycheck, which she thought was hilarious. Like she was like, I get to sign off on the fact that you did all these things for me. So there are other programs, and sometimes it took a really good friend to find that one. So there is financial help as well. There is one question. I see it. And Aura, thank you so much. I'm going to ask one more question of all of you again. I'm just going to go in alphabetical order because it's easier. And I'm going to ask you the question that was very hard for me to personally answer, but I get asked a lot. What did you do for yourself during that time to take care of you? And so, Ashley, I'll start with you.
That's a tough one, especially Presley is one of 4 children. I have 4. But I really had to give myself hope with all the negativity and all the things that were going on with Presley, and just us as a family as a whole. I really kept telling myself, you have to have hope. If you don't have hope, for me personally, what did I have? So that was something that I kept telling myself, is just to keep having hope and just to trust the doctors and listen to them and figure out that, everything at the end of the day would be okay.
Azure, how did you take care of yourself?
Oh, if I'm gonna be honest, I didn't all that much. I ended up
feel ya.
doing a lot of overeating and a lot of taking care of everybody else. I will say though that the one biggest thing that I did for myself was I refused to wallow in my pain and just accept it. I actually sought you out while I was still in the hospital room listening to his death rattle. I was like, no, I'm going to
I
do something
didn't know
about this.
that. I didn't know
I
that.
had to do something with my pain. So yeah, before he even passed, I was like, I need to do something because otherwise it was going to feel like, this was all for nothing. It's like,
Oh,
because what you do helps at least some people not
Mhm,
die that way. That's the whole point. We want people to catch it
mhm,
sooner. We want them
mhm,
to live longer. We want to hear more survival stories. Like I know
mhm.
so few still, but I love hearing them every time. And that's part of why I'm here and do what I do is because it gives my life meaning. So I'm
cute. Oh
glad
my
you're here.
God, you made me cry, girl. I thought I can get through this without
Sorry, but
crying.
like
Oh
that was
my
just
goodness.
about it. Like I
Oh,
wasn't good at the self-care, but
thank you. And I
that's
want
the one.
to
That's the big one.
shout out to yeah, self-care. Yeah, I wasn't terrible at it. Shout out to Azure too. She's one of our regular donors and her company matches her gift. So Aura, if you could put that in the chat as well, ways to continue to support Blue Fairy's work. Cathy, same question to you. How did you take care of yourself?
Well, it's interesting what Azure said. I did seek out, I mean, at the time, I don't think I knew about Blue Fairy until after Matt had died. I don't
We had
remember.
just
Anyway,
started. Yeah.
yeah, yeah.
Yeah.
So, but I did seek out, communities online, and I do think it was very helpful. I spoke to a few women who were going through it at the same time. I was able to ask those questions that maybe were hard to ask a doctor in front of Matt, if that makes sense, and just sort of connect with
Yeah.
those people. And it was huge. You're right. And then at the very, very end, I will say that I needed some time where I just got out of the house. It was so hard. I mean, you all know how hard it is to watch a loved one suffer. And I was just, sometimes I'm just, I need to get out. There are people who are, will be there with him, his mom, his siblings, friends. And so I did. And, it's interesting because on one of those listservs, someone was saying that they were sort of criticizing their mom for leaving some right towards the end, right? You know what I mean? Just getting out and doing some things. They didn't understand it, didn't they? Love their loved one. And frankly, I mean, I responded to her at the time. I said, probably loves them so much that it's just for their sanity that need to get out for a little while, not long, but just because it's very, very hard, as we all know, to
Yeah.
watch that.
Hey, Adrian pushed me out the door to go to a Depeche Mode concert. It wasn't even my favorite band,
Yeah.
she was supposed to
For her.
go and her boyfriend and she made me go instead. And she was like, "You never leave the house. You never leave my side. Go."
Yeah.
I was like, "Okay." So Julie, how do you take care of yourself now?
Well, I don't think I've taken care of myself really great, but I don't have an off button. So I love nature. I have critters that I have stories about critters you would not believe. Bats, squirrels, crows. I have friends galore, and I have just loved all the little guys around me. We get a lot of pleasure watching them and walking, going out in nature, breathing. Those are things that help me to connect.
And you
you know.
paint. I mean, you're very
Oh,
creative.
yes,
The
yes, yes,
creative
yes.
outlet.
Yeah, that's a whole other area. I don't want to talk about that because that I could do all day long, but I love to create because that's my personal space where, you're you for a moment. You're not just that caregiver. You're not just in cancer.
Mm.
You're outside for a little bit. And you get to make things that make people smile. If you give some of your things away, if you choose to gift them or just surprise nurses, I make little journals and beads and, all kinds of fun things. So I think as sad and as much grief that I'm in, it helps me to bring joy to someone else that I know is going through the same thing.
Love that. Karen, what about you?
That's
How did you
lovely.
take care of yourself and how do you take care of yourself now?
Right. Well, likewise, I didn't do a very good job during the time, but I do like to be outdoors, so I would definitely make sure I get my walk in. If nothing else, I would definitely do that. Um, yeah, I'm just really, really trying to, but it was so hard to just step away. It felt hard, and now that as I do things, like maybe just go to the hairdresser, I remember the time when I was there and what Michael was doing and how that experience was every time he stepped away. But I think really trying to find joy, but in the quote unquote little things, what can you do every day that would just make you smile? Because you can't just go and get a massage and do all of those things with any regularity. It has to be, what can I do, now and for myself, and how do you find friends? I remember connecting with Sarah. I was leaving the hospital and I saw this flyer right by the elevator, and I said, I'm just going to reach out to these people. And then she called me, and it was, I mean, she is such a blessing. She was and still continues to be such a blessing to
She
me.
is. And well, shout out to Sarah because she just had a birthday.
Oh, did
And
you?
she did, and she serves on Blue Fairy's board of directors. So big shout out to Sarah. We do have one question from the audience. If you're comfortable answering it, this one's for you, Ashley. Can you share your daughter's Instagram, please? Thank you so much.
Okay. Yes, let me just touch base. I don't have social media, but yeah, I think that it would be okay. Let me just reach out to her and get her exact, you have it,
Okay.
I don't.
I know. I would have to sit here on my phone and look it up.
She's so funny. Yeah, it's one of those mom things, but I don't have social media myself, so I think it would be okay, but let me just get her confirmation quick.
Okay. So Melody, if we say goodbye, and she's okay with it, we will put it on the YouTube. But I just love that you want her Instagram. So follow Blue Fairy on Instagram too, at Blue Fairy Liver, yes. Yes, and also Aura, our program manager, wants me to remind everyone that we will have this up on our YouTube channel on Monday. So if you are watching the replay, we will have links to our liver cancer community. It's a private HIPAA compliant forum for HCC patients and their families. Anyone can join. It's super user friendly, so it kind of feels and looks like Facebook. But unlike Zuckerberg, your information is actually confidential in the HIPAA compliant community. And also I want a big shout out to our sponsors. We have 3 sponsors this year for this program. So thank you so much to Azi, Exelixis, and Merck. They have no control over the content whatsoever, but they do support this program. And again, if you want Blue Fairy to continue to provide these programs and services for free, please donate to us. So it really means a lot to us so much that we can continue to do this. And I just want to thank all of our panelists. Obviously, this topic is very near and dear to my heart. And all of you at some point today, I could have cried through every single story, and I'm about to, but so thank you so much, Cathy and Azure and Karen and Julie and Ashley. I so appreciate you sharing your story because I know it is not an easy thing to do. And oh, can we please have the YouTube channel? All right. Aura, will you drop that in the chat before we say goodbye? Also, if you go to bluefairy.org, that's BLUEFAERY.org, our YouTube channel's at the bottom with all of our social media. We're Blue Fairy Liver on most social media channels, or Blue Fairy Liver Cancer. But we'll give Aura a minute to drop that in the chat. There it is. Thank you so much. Aura, you did a fantastic job. Ladies, thank you. I hope you have a fantastic weekend. And thank you to everyone watching. Take care. Bye-bye.
Thank you.
Thank you.
Bye.
Bye-bye.
Thanks, everyone.
Thank you for
Bye.
all you do too.
Yes.
Yeah.